When we started Integrated Orthopedics in 2015, we had the clinic side and we had the physical therapy. So it really was two parts of the puzzle of trying to deliver the best patient care we could. About half the time that we spend is in clinic and half the time is in the OR. When I go to the hospital and the surgery centers, it's not my direct control. So in 2018, I sort of had the concept of let's do a center. Starting a surgery center is a huge endeavor. We found the location, and then we started to look, how are we going to do it?
So this used to be a grocery store chain, which sat vacant for a period of time, that it's well located in Phoenix.
When we started the project, there are a couple of different ways to do it as far as partnerships. So you can sort of piecemeal it, your lights and your booms and your towers and your implants, from multiple different companies. What we chose to do was work with Stryker. Really, it was a no-brainer.
When you're working with a best-in-class company like Stryker, it's hard to go wrong. It really empowers our practice to be able to do the things that we want to do. We really spent a lot of time designing our center to be safe for joints and to also do volume.
So we're standing in the SBD, which is the sterile processing area now, and we've really developed this to do 20 joint replacements per day. A lot of the current ASCs are doing some joint replacement. You're just not really able to leverage throughput because you do not have this area here which cleans the equipment. So for example, you may be able to do 1 or 2 joints per day, and that can kind of max out what you're able to clean and sterilize. We're going to have our patients working with physical therapy here, so they're going to be able to begin that recovery process, essentially 2 hours after they've had their knee replaced or their hip replaced.
We all know that there's a lot of barriers to entry here. Stryker made that much easier. We were able to get a tremendous amount of capital, and the partnership there really allowed us to build a first-class center. Stryker's been an excellent partner. We were one of the first centers that they really coordinated with, and we're proud of that, and they've done an excellent job for us.
Our lobby is super important. It's the first thing that the patients will see. I think they're going to come into a facility and immediately feel good about where they are.
This facility allows us to take the best care of our patients. It's really a special situation that you're able to utilize one company to develop the vast majority of your center. To really see the breadth of Stryker's product line. When we walk into the OR, it's all Stryker.
So welcome to OR1. As you can see, all of the Stryker equipment is present. Really, when we were talking about developing these, we really wanted these to be, equivalent to a hospital-sized OR, which they are. We have our Neptune, our towers, our booms.
When we have the Mako robotic arm, surgeons are going to be able to come in, run 2 rooms, cut half the time off their day. It's going to be a positive reflection on their practice that they're coming into a state-of-the-art facility. The Stryker products really do give you a significant amount of confidence in what you're doing. You're not going to have to worry about the equipment, and I know that if something does go down, we're going to get something same day, next day. It's really going to make a big difference. My big goal for Integrated Orthopedics is to continue to grow. We're expanding already our 3rd and 4th ORs. The future with Stryker is bright. Stryker and Integrated Orthopedics, I feel, are both best-in-class companies. So when you can combine 2 companies like that, you can do some pretty powerful things.